Welcome to the Mental Health Hour. Tonight is episode 96,
Mm.
fastly approaching the great 100. That will be tentatively broadcast on July 12th, I think it was.
Yeah, something
That'll
like
be
that.
the 100th episode, and we're just going to have fun for that episode. We're
Oh yeah.
going to look back at some old episodes or old clips and talk about the show, just hang out, kind of, just
Yeah,
celebrate.
definitely gonna be one to watch.
Gemma, you've got some stuff in the works, don't you?
Oh yeah. Definitely don't want to miss it. It's gonna be a laugh, that's for sure.
So, tonight we will be getting into dissociative disorders. Um, this is kind of, it's not new, but in particular, it's a broad category or um, realm of uh, disorders that all clump into dissociative disorders, and we'll get into each of them. Most probably the most prominent one is dissociative identity disorder, which was formerly known as multiple personalities disorder.
Mhm.
Let's begin with what is dissociation. Um, do you know anything of the sort, Gemma?
I know after some of the traumas that I'd had with the rape and things, I was diagnosed with having it just completely dissociating from the world, basically.
Yeah,
Um, I described it as like switching off from reality.
exactly.
The best way to describe it, just being somewhere else in your own world.
Yeah, off on another spectrum, off on another planet, if you will. Um,
I have
it's
to wonder if that's a better place to be sometimes.
well, and that's probably why our our brains, go into that mode is to escape the stress or the trauma. And
Yeah,
as a matter of fact, that's what it's all about.
self-preservation, really.
Dissociation is your body's natural response
Hmm.
to trauma, stress, anxiety, depression, the like. So, all of the stuff that we get into really on the show, uh, kind of a natural response from the body is to dissociate, um, and pull away from the bad, if you will. Um, Nail Driver says, sounds like kind of a reset. Yes, essentially. Um, your brain's resetting itself, I guess. That's a good way to look at it. Uncle Rick, like me, currently camping. I'm escaped from the everyday, pure relaxation.
Oh,
Yes,
that seems bliss.
if you're completely ensconced in your camping and completely absorbed in it and not uh, aware of anything else, essentially,
Mm.
your own presence, really, even. So, dissociation, we're going to get into some slides, of course, and we don't normally show this many videos, but this one I felt really could use it. So there's from our friends over at Psych to Go as well. We have another video, little 5-minute thing, but it really helps, and we'll probably start with that just to get a basis of knowledge before we get into conversation.
Hmm.
At the beginning of the video, they included a little 3-question quiz to see if you have any of the symptoms. So you can play along with that. But as it says right on the video, it's not a diagnostic tool. Um, it's just merely to become aware.
Yeah, it can be used as an aid to go and seek further advice if you feel that you need it and you meet the criteria that was stated in the video.
Absolutely. But dissociation, I mentioned probably the more prominent of the types of dissociative disorders would be dissociative identification disorder. It's a mouthful. Dissociation is a word that doesn't roll off the tongue for me very well to begin with, and then add in all the other what's the other? There's amnesia, dissociative amnesia. There's dissociative fugue, and there's regeneralization or something like that. But we'll get into that. So dissociation as a whole, though, is your body's or your brain's response of pulling away from reality. Essentially, like it has also been described, I believe, as like out of body. Um, Not that you're looking down on yourself, but just that you're not in your surroundings. You're not there. Um, you can dissociate. It's normal for everybody to have dissociative episodes.
Mm.
Just because you can relate with a dissociative episode, that's completely normal. It doesn't mean that you have a dissociative disorder. Um, Things such as being, absorbed in a book, really absorbed in a book or a movie, and not aware of your surroundings, what's happening around you. That's an example of a dissociative episode. Um, Another good one is when you drive like a familiar route of travel, like back and forth to work, and
Yeah.
you get there and you're like, I don't even remember
Autopilot
getting
kind
here.
of thing.
Yeah,
Yeah.
no recollection of the drive over. That's a dissociative episode.
Mhm.
Um, so let's look at dissociative disorders, which is now we're going to get into where it can become more of a mental health concern rather than just an everyday part of life. We'll start with the Psych2Go video. Just get a quick rundown, and then we'll get into some slides and stuff. Enjoy.
Ever wondered if you might have a dissociative disorder? If so, take this quiz and watch for more info. Before we get started, we made this quiz to help you out. Choose whichever answer closely relates to you. Number 1, do you experience frequent gaps in your memory? A, yes, all the time. B, yes, sometimes. C, once in a while. Or D, no, not frequently. Number 2, do your surroundings seem, at times, two-dimensional? A, yes, it happens a lot. B, sometimes. C, no. Or D, no, what are you talking about? Number 3, do you feel detached from yourself? A, yes, it's like I'm watching myself. B, sometimes. C, not really. Or D, never. If you answered A to most of them, there is some chance that you may be experiencing a dissociative disorder. In everyday language, many use the word dissociate, sometimes as a passing comment and occasionally as a joke. However, dissociation can point to unresolved trauma. Dissociating is more than zoning out. It's a coping mechanism against trauma. And in the long run, it affects your thoughts, emotional state, memories, and even your sense of identity. Although it is a helpful coping mechanism, frequent dissociative events make life difficult as they're disruptive to everyday life. So, what are some types of dissociation? There are 3 types: dissociative identity disorder, dissociative amnesia, and depersonalization or derealization disorder. While each type has different symptoms, they share various traits, such as feeling detached. Detachment is a key sign of a dissociative disorder. You feel detached from others, your surroundings, and yourself. It's an easily recognizable trait for those who experience depersonalization or derealization. However, it takes self-awareness to realize that you are feeling distant from yourself. Take some time to check in and reconnect if you feel a bit removed from yourself. Another sign is a blurred sense of identity. Along with a feeling of detachment, you can also experience a sense of blurred identity, which may feel like you've distanced yourself from your core values or like you don't recognize yourself. If you feel this way, do things that will help bolster your sense of self. Explore some things that you may have stopped doing. Do things authentically. And always reach out to a therapist if you need help. Next sign is memory gaps. A common sign of dissociation is having memory gaps. Memory gaps are not due to external factors or medications, but occur without any easily recognizable trigger. Noticing memory gaps is difficult because you're unaware you missed anything. Hence, it's usually a worrisome sign to see. A great way to become more aware of potential memory gaps is by journaling. Keep a journal of everything you plan to do that day or week. The next sign is an inability to cope with stress. Dissociation is a response to stressful situations. A clear way to recognize dissociation early is by measuring your stress tolerance. If you notice that stress affects you more than usual, your brain may resort to dissociation to cope. Clear signs of an inability to cope with stress include irritability, hypersensitivity, and persistent fatigue. If you are overwhelmed with stress, take a step back and do less. It's easy to get overwhelmed by pressing tasks, but sometimes in order to do more, it's best to start small. If doing less does not seem like an option, do something that helps you release stress, like exercising, dancing, or painting. The fifth sign on this list is unreal surroundings. Another characteristic of dissociation is a sense of unrealness. Surroundings can feel like props on a set or a part of a 2D painting. This symptom is typical in cases of derealization. Derealization is a type of dissociative disorder itself, but the symptoms of derealization can also persist in other types of dissociative disorders. To be classified as a symptom of dissociative disorder, the unrealness of your surroundings must not be caused by external factors. If you notice frequent moments of derealization, reach out to a therapist for help and guidance. Dissociative disorders can also be comorbid or occur at the same time as other mental health issues such as depression, anxiety, and PTSD. If you notice any of the signs discussed in this video and want help, reach out to a therapist who can guide you through cognitive behavioral therapy or talk therapy and offer an open and safe space for you to talk. Have you experienced any of these symptoms? Let us know in the comments and share this video with others who might benefit. The references and studies used are listed in the description below. Until next time, friends, take care and thanks for watching.
All right. So a good little overview of everything. I felt it was important to show that video particularly because it covered not all of them. There's more to it. Those are the big ones. So there's a quick overview of it, and now we can kind of get into some talk and slides and see where that takes us. Because normally when we deal on this show, when we deal with a topic that's so broad or has a lot of components to it, we don't really scratch the surface, or we'll get one tracked on one of the particular things, and like just not forget about the others, but we don't give them as much love. But that's why we make 2-part series and 3-parters and 4-parters. So there's at least a little overview. Gemma, do you have anything from the video?
No, I think you've covered most of it, but you've gone for a walk, so maybe I should talk. I definitely had dissociating episodes after some of the traumas, and it's when you're doing it and can't control it. Like I would go for a walk, put my music on, and completely dissociate from everything around me to the point where it became dangerous. So yeah, definitely if you recognize any of those things and it's happening frequently, get some help, because if you leave it too long, it can become an issue.
Right. And as with anything, exercise and journaling, here it is again. That should just be the sub motif of the show. What do you think?
Oh yeah, definitely. Journaling can help as well if you need to go to a doctor or a therapist to be able to take it with you. And I mean, I'm not saying show it to them or anything, but it can help you recap some of the things you've been through, because when you start dissociating, you're not forced to remember it after a little while. So it can help you recap and go through the things that you've been through. Keeping records of things that have happened, stuff like that. So
Yeah,
that,
I've often kind of referred to it as your playbook.
yeah,
Essentially, um, you go back and review game tape or film before you play a big match, right?
hmm
Same thing. You go back into your journal and see how far you've come, what you've accomplished, what has might maybe tripped you up, and how you've handled it, etc.
mm,
All of these. There's many different things you can journal and log and get into, um, and then you can go back and review. Uh, so once again, we are highly um, we're big supporters of journaling. Um, and as I've said before, I'm the pen and paper
mm,
guy. I like to actually sit with my thoughts and write them down physically instead of. But I mean, to each his own. I'm
mm.
not knocking the new AI technology or even
Yeah,
logging stuff into an app. Um,
that's what I do. I used to do it in books. I've still got lots of books, and for Thomas's first year, I used to journal everything, more for like to look back on, but to also put in his memory box, things like that. But as my hands and things have become more with the arthritis, I find it easier to do it on an app. And sometimes all I want to do is just put a couple of things if I'm that feeling that meh, that I just put a couple of things and that's enough. And then sometimes I want to type loads of details and whatever works because it's not something that's ever going to get marked or looked at by anyone else unless you choose to do that. So just do whatever feels right for you.
that's right. Sound advice as always. We will move forward, and if anybody has any questions on the video or any questions on the upcoming slides during the presentation of them and subsequent discussion, please feel free to drop them in the comments. Good evening, Joker. Good to see you. Um, we love uh, trying to answer on the fly, especially when we're doing a topic that I'm not as familiar with. I mean,
Mm.
sure, I could relate immediately with the driving and losing, or not losing consciousness, but uh, not remembering the drive.
Yeah.
That's
You just
happened.
go into autopilot, don't you? And you just go with it.
Yeah, it becomes second nature, especially on a drive that you've done um, over and over again. Uh, Kind of like the car knows the way at that point. Autopilot is perfect. Um, so yeah, just pop any questions in the chat. We'll try and get an answer on the fly. If we aren't sure, we'll get back to you with it.
Mhm.
As mentioned, all of the slides and the videos. I have to put the videos. The videos won't upload into the Discord, but I can put the links, and it'll take you to the exact video page, and that's a perfect way for those listeners on Spotify or any of the podcasting platforms. You can hear the content from the video, but
Mhm.
um, obviously you can't see it. If you want to go watch it and see it, that will also be on the Discord now. So let's take a look at some slides. We'll start off basic. We'll start off with what is it, as we always do, and we'll move through them to hopefully get to some kind of ideas of treatment. So Gemma, if you are ready, please.
Yeah. I wonder how many words you've picked out that I can't say tonight.
I didn't even really look too much.
I haven't looked again. It's
Yeah.
just yeah. Okay, let's go with it. So dissociative disorders. Dissociative disorders are mental illnesses that involve disruptions or breakdowns of memory, consciousness, awareness, identity, and/or perception. When one or more of these functions is disrupted, symptoms can result. These symptoms can interfere with a person's general functioning, including social and work activities and relationships. The dissociative disorders we will look at include dissociative amnesia, dissociative fugue, and dissociative identity disorder. Nearly got me there.
So there's a word, fugue. Not a whole lot of people that. I mean, I know what it is because I can't remember. I learned it at a young age.
Mm,
Fugue is essentially um, it's like a where you somebody wanders off and winds up in another city, isn't like they could possibly wind up in another city and have no idea how they got there or why they're there. They just went into a fugue state. You see it, I guess, with patients with Alzheimer's can kind of wander off and um, forget why, but there's an obvious reason from their diagnosed amnesia or Alzheimer's, um, or dementia. But it does happen to somebody without that diagnosis as well sometimes. Um,
mhm.
I'm not sure what triggers it. Possibly, I guess, just like we're going over here, just the body's way of dealing with stress. But that's an extreme case to wander off and wind up in a town over, um, and
I've
not have.
actually done that. I have actually done that. I used to put my headphones in and walk, and I would end up. I had no idea how I got there. That's what I was saying about earlier, like when you do stuff like that, because that can be dangerous. Because I don't know whether I'd stopped and looked for traffic or anything. No idea. So
Yeah.
if
And
you,
and Craig says mental fogginess. It's more extreme than that. It's mental block, really. There's
it's like
zero
complete
recollection of.
shutdown of everything.
Yeah,
Like you're there,
zero.
not
Like
there.
you could be missing out on 3 days. Have
Hmm.
no clue. So that's essentially what fugue is. Let's move on to the types real quick.
Hmm.
So we went over it, or we saw it in the video, but here it is on one of the slides, so we can go over real quick.
So yeah, we've got the types here. So there's dissociative amnesia, and it says it's a condition where a person is unable to remember essential details from their past. This disorder occurs when a person blocks out certain information, usually associated with stressful or traumatic events, leading them unable to remember important personal information. Depersonalization, derealization disorder. It consists of recurrent feelings of being detached from one's body or mental process, usually with a feeling of being an outside observer in one's life or being detached from one's surroundings. The disorder is often triggered by severe stress. Dissociative fugue. People with this disorder temporarily lose their sense of personal identity and impulsively wander or travel away from their homes or places of work. Their condition develops due to excessive psychological trauma or other mental conditions. The sufferer may experience memory loss and forget information related to their personal history and individuality. And then dissociative identity disorder. People with dissociative identity disorder have two or more separate personalities. These identities control a person's behavior at different times. The ID can cause gaps in memory or other problems. It is usually the result of sexual or physical abuse during childhood.
Perfect. So there's fugue. I'm actually glad it was that. That's way better than how I tried to explain it, but
Mhm.
essentially the same. Wander or travel away from their homes. So like it's more than, I guess, the way I made it sound. It probably sounded like they just wander off on foot. There's people that just get into cars and roll out, and they're just out there. Now that their body's going through the motions, I mean, obviously there's a part of the brain still functioning for controlling a vehicle, watching
Mhm.
traffic, stopping at stoplights. I mean, they're not out there blindfolded driving or anything. They get to their destinations safely. They just don't recall it. There's
Mhm.
that part of the brain has shut down. There's no memory recall.
Yeah, yep. I can definitely relate there.
And then dissociative identity disorder, that being the formerly known as multiple personalities disorder, um, often misconstrued as schizophrenia. There are, um, I guess, some similarities, and schizophrenia and multiple personalities kind of almost went hand in hand. Um, it's for a while, but now that it's taken on its own identity as a dissociative disorder, they've gotten it away from schizophrenia. Schizophrenia is more in the psychosis type side of things. This is a dissociative. There was actually a, a slide that I came across, and I didn't put it on the show today, but it was uh, looking at dissociative identity disorder versus schizophrenia. I'll find that and I'll put it up on the Discord with these slides if you're interested in checking that out. Please feel free to !Discord in the chat and you can get your invite link. We should probably make sure that invite link is still good.
I checked it a couple of weeks ago and it was.
Okay. They're supposed to be, but sometimes they malfunction or whatever. But you do have to go in and hit a special button to make it a forever link. So there's the 4 types again. Pretty self-explanatory in a way. I mean, it's not overly complex, I hope. I felt like those were some good definitions and a good look at the 4 types. And again, I keep saying the 4 types. There is a lot more to it. There's more subcategories and um, other diagnoses that fall under dissociative disorders. These are the 4 main players, though, the big ones, if you will. So let's look at the next one, which is symptoms.
So common symptoms of dissociative disorders. So memory loss or amnesia of certain time periods, events, people, and personal information. Mental health problems such as depression, anxiety, and suicidal thoughts and behaviors. Significant stress or problems in your relationships, work, or other important areas of your life. A perception of the people and things around you as distorted and unreal. A sense of being detached from yourself and your emotions. A blurred sense of identity and an inability to cope well with emotional or professional stress.
So, all pretty much looking at it, a couple of things that pop out, or what we've already essentially covered with dealing with stress and anxiety and such. Let's go on. We'll come back to this one because I want to get into some symptom stuff more. But let's look at this one first.
Yeah. Okay. So, what is dissociative disorder? Dissociative disorders are mental disorders that involve experiencing a disconnection and lack of continuity between thoughts, memories, surroundings, actions, and identity. So, symptoms are impaired sense of self, loss of memory, emotional numbness, out of body experiences, and difficulty concentrating. The types: dissociative amnesia, so a condition where a person is unable to remember essential details from their past. Depersonalization, derealization disorder. It is a dissociative disorder that can cause a person to disconnect from reality. Dissociative fugue, and in this, people won't have any memory of their past or about themselves personally. And dissociative identity disorder, people with DID have 2 or more separate identities. Causes, so traumatic experiences, genetics, excessive stress, sexual and emotional abuse. Treatment, so psychotherapy, talk therapy, cognitive behavioral therapy, dialectical behavioral therapy, hypnosis, eye movement desensitization, nearly, and reprocessing, medication such as antidepressants or antipsychotic drugs, self-help strategies, so talking to trusted friends openly about issues or problems, seeking professional help and joining support groups, and then coping, so mindfulness. By increasing understanding of dissociative process, mindfulness can help anticipate and manage dissociation. Healthy eating habits. It's important to eat nutritious food and avoid junk food, alcohol, nicotine in order to recover faster. Exercise. Regular physical activity can also help a person deal with and alleviate symptoms of DD, dissociative disorder. Adequate sleep. Getting enough sleep can help to overcome stress, anxiety, and overthinking. And socializing with friends and family is also important for developing a healthy mindset and being grounded with your reality.
Thank you, Gemma. That was a big one, a lot to cover there. And I probably, in hindsight, should have cut it up to make it a little bit more eyeball friendly. But a lot of good information on this slide. This one is from courtesy of Mind Journal, a very good site if you're into researching any of the topics we discuss, or you just like further information. Very well mined. I love obviously the Psych2Go YouTube, and they have a website as well, and then Mind Journal as well. And then we'll make mention of mind.co.uk. That is also, we did the episode with Vegan Doe, and she was doing the walk for Mind. That's their website. They have a lot of very good information, all free. Just get on there and take a look, and that should be more UK based, I believe. So looking at, I wanted to go over a few things. The treatments, and we'll get more into treatment. But the one that you had a little trouble pronouncing there, where is it? Eye movement desensitization and reprocessing. That's AKA, or shortened down as EMDR. You may have heard of EMDR. That is the light processor, or that moves back and forth, and you watch with your eyeballs as you're being counseled or therapized with a preferably a trauma clinician, somebody in the field of trauma processing. Will if you qualify for it, it digs deeper into you, and watching that light, or sometimes it's like a vibration device in each palm that
Yeah,
just
I had that.
back and forth while you're talking to your therapist or the trauma clinician. They will, that somehow opens up the
It actually
in your
does.
brain, and they're able to dig out more.
Yeah, I had that for trying to recall memories, and he was doing it to me while I had in the room. He made me lay out a physical timeline of events, so I had to go stand at certain parts of the room whilst I had these in my hand, and he would keep altering how strong the vibrations were, and I had to go stand on certain parts of the room, which were at that time my timeline. And it did actually help me bring back some of the memories, because I have got a significant loss of like parts of my life from years ago due to trauma. It's as though my brain has just completely shut that memory out of there. And there's a good few years that I have no recollection of whatsoever. And I wanted to try and regain that so that I was in control of when it came back and what I did with it. And it's trying to get it back and piece it together. It's difficult, but it does work if you persevere with it.
Yes. And a lot of uh, folks that I know, when I was down at the rehab center, getting myself together and off of alcohol, I did a lot of trauma processing. Um, I didn't qualify. I mean, I probably did qualify, but I didn't. I wasn't a priority, I guess. And they only had one EMDR certified clinician on campus, and this was during times of COVID, so it wasn't like they could bring people in and out willy nilly.
Mm.
So the folks, I wasn't on the high side of the list to get EMDR, but the folks that did do it, they came out feeling like woozy, some of them, and um, but they said they all said it was just a great experience because they were talking about shit they didn't even have any idea tied into. I mean,
Mm.
it's nuts to kind of see. You can do a little research on it if you want. Just type in EMDR, all caps, and a whole bunch of information will come up for you on Google, and where you can find it in your area, people that offer it. Uh, but they'll start you with just regular therapy
Mhm.
or trauma processing and see if you're a candidate for the EMDR because I don't believe, at least here, uh, I don't believe they offer it to everybody.
Yeah, it's private here as well. I definitely went through many, many other forms of therapy before I had it, and even then it was private. So yeah, um, it's good, but you have to meet certain criteria, I think, or have loads of money.
Yeah, it's great for the obviously the PTSD folks,
Mhm.
folks suffering from PTSD, um, military vets, firefighters, and even non-uniformed employees. Just civilians suffer from PTSD as well,
Mhm.
uh, and they don't often get a diagnosis. So that's something to look into as well, to get into. Uh, let's continue on forward, or hold on, let me pull this back up. There was something else. Mindfulness. Um, that's it. To me, it sounds like the exact opposite of dissociation. Being present, being in the moment. We've done a mindfulness episode. We got to do another one. It's just that damn important. Mindfulness to our mental health. Uh, Practicing mindfulness in your daily life. Practicing. Um, Shit. We just did an episode on it. What the hell was it? Not mindfulness. But mindfulness was the root of it. What? Jeez. Let me go back here and uh, take a look. That wasn't. Oh, grounding techniques. Duh. Grounding techniques. Practicing your grounding techniques. Practicing mindfulness. And practice or being aware of cognitive distortions. We've done an episode on that as well. That's another one I want to get back into because that's a part of this CBT, cognitive behavioral therapy, which is in the treatment section here. Um, uh, Therapy, uh, often they'll do what's called cognitive behavioral therapy or dialectic behavior therapy. These are also things that we've covered on the show. We did an episode on CBT. Um, that is something that needs to be done with a trained professional,
Mhm.
and it is it's not anything like invasive or intense. It's just um, therapy. It's its own branch of therapy. We'll get back into cognitive behavioral therapy. I think we have 2 episodes on it actually so far, but
Yeah.
one of them is all about cognitive distortions. And if you're aware of your cognitive distortions, because we all are guilty of them, that's if you remember fortune telling, um, and there's a whole list of them. jumping to conclusions. Just
Mm.
because this happened doesn't mean it's going to happen again. Or, if you're fortune telling, you're just thinking to yourself, there's no way my numbers hit or on the lottery, or I mean, that's a piss poor example, but you know what I'm saying. Like, I'm definitely not going to get that promotion at the office. I'm definitely not. Well, why? Why are you jumping to conclusions? Why are you trying to tell the future? You just don't know, and those are called cognitive distortions. Anyway, um, I do want to do another episode on that because they're important as well to go over.
Mhm.
Let's go ahead and pull this one up. Kind of a what is again.
Yeah. I'm just gonna flip that around.
Oh,
Okay.
this one, by the way, I was all about the multiple personality disorder. I wanted to throw something in about this one alone, just because
Yeah.
it's probably the most well known.
Yeah. Okay. So, what is dissociative identity disorder, referred to as DID? Multiple personality disorder. So, a psychobiological response to traumas suffered in a specific time window in early childhood, a dissociative disorder, and a complex post traumatic stress syndrome. And then, how does DID develop? An important step in childhood development, the forming of a central integrated consciousness, is impeded or prevented by a chronic trauma. The child uses radical denial and splitting to cope with the traumas, imagining that the trauma happened to someone else. The child's fantasy, capabilities, and imagination give the different personality states their individual characteristics. Extremely inconsistent and contradictory behavior by attachment figures and their denial of the traumas suffered by the child additionally foster the dissociative coping strategy.
Excellent. So, dissociative identity disorder or multiple personalities. Um, just got its own category now. Oh, and Dimmy, good to see you. I didn't see you sneak in. Thanks for stopping in. It's good to see you. I haven't seen you in a while. And Michaela, of course, you're allowed to talk about mental health in chat.
Mhm.
You can go ahead and uh, join our Discord as well, Michaela, if you want. And as Ray put in there, and Hattie's been promoting as well. Um, and there's all kinds of everybody in here. Uh, Usually, everybody in here is over in our community on Discord as well, and
Mhm.
it's all mental health all the time over there. So feel free to jump in.
Yeah,
Uh,
lots of help and support things, resources, all sorts of things that are in there. So, yeah, definitely worth a join.
Absolutely. And speaking of the Discord, let me throw up real quick. Uh, Friday, June 23rd. I don't want to forget this as I did last week, so I'll just do it now. The community check-in on Discord. There's a QR code there. You can scan it right off of your computer screen, or it's up on our socials as well. That has the invite link to the Discord. Join the Discord,
Good.
and come hang out with us June 23rd at 5 p.m. Eastern Standard Time, and that'll be 10 o'clock Gemma time in the eve, 10 p.m. Um,
Yeah, I have my own time zone. Did you know?
what it is on Discord is it's kind of akin to a Zoom call.
Hmm.
So you have the option to be on camera just like this,
Hmm.
um, or you can go off cam like this and just be talking. Um, you don't like I am right now.
Hmm.
Be off camera, but we can still hear you. Um, or you can just mute everything, hang out in the room with us, just listen, and and join in if you feel. You don't have to talk. You don't have to. But if you want to come hang out, feel free. We'll be there Friday, June 23rd at 5 p.m. Eastern Standard Time or 10 p.m. Gemma time, and we go for about 45 minutes. We're blocking it to, or we try to block it off 45 minutes to an hour, no more, because Gemma is fastly approaching bedtime at that hour.
Yep.
And when it's not a live stream, when it's just a hangout, we can easily go 3-4 hours. And so the first one we did, I was at work. I got called into work actually, so I could have been called away on it, or I was called away on an ambulance call but I was there for a good majority of it.
Yeah,
Anyway,
yeah.
I wanted to throw that in there because I forgot to last week. But join us in the Discord. Okay, now back to the multiple personality. Everybody's probably heard of this. Everybody's probably confused it as schizophrenia. It's just another. It's you got to have more than one personality, I
Mhm.
believe, to even count, right, Gemma? Did I get that
Yeah,
right?
yeah. Yeah, and it has to be consistent for over so long, which is why there's so many conditions, not just to do with dissociative disorders, but so many conditions of all types that have like overlaps of symptoms and things, which is why we always say if you can relate to any of this, see a professional to get the diagnosis, because getting a wrong diagnosis can cause more harm than good. So it always pays to get it from a proper therapist so that
That's
you know what you've got and can go on to get the best treatment for that.
that's 100% absolutely true. And you can with a general care physician or a
Mm,
general practitioner, but get a referral to a psychiatrist or psychologist for
mhm.
anything brain related or mental health, essentially, um, especially if they're going to be prescribing meds. Uh, just talking to a psychiatrist who can prescribe medication, not a psychologist cannot, but a psychiatrist is a prescribing doctor. They are a doctor and can prescribe medicine. They're the best ones to talk to about that because their whole focus is in that field, whereas a general practitioner or general care physician is a jack of all trades. I mean, they see everybody from the sniffles to a broken thumb to back problems, etc.
Mhm.
Um, Demi says it's hard in the UK to get an appointment. NHS. Gemma, I
Yeah, very
think you've
much at the moment, yeah. But honestly, if you are wanting some assistance with getting that, I would highly recommend getting an advocate. There are many of them about free, and you can also contact PALS as well, which is UK related, and they can help chase up any appointments. And you can go to your GP and ask for it to be expedited, which again will push to get it if you've been waiting for so long. But message me if you need any of that. Sending in text. I can, if you give me your area, I can send you an advocate local to yourself to get in touch with.
right. And Michaela asks, is it the same time frame to develop CPTSD and DID? That I'm not 100% sure. I know CPTSD is complex post-traumatic stress disorder. That is exactly what we covered in the episode with Beta Ashley. Uh, so I don't remember what number that was, Michaela, but if you go on to actually I have it right here, the YouTube channel, um, there is an episode called CPTSD. Um, it's actually called PTSD2, a look at CPTSD with Ada Ashley. Um,
Mhm.
and she is diagnosed with that. She goes over everything. I don't have that, so I'm not 100% spun up on CPTSD.
I
But
think it's to do with the amount of events that occur over a certain period of time, because you can say, for example, 6 months and only have a couple of incidents, whereas if you could have 3 or 4 within a month or 2. So it's just a case of how many incidents it is and how many of the symptoms you've got, not necessarily the time frame, but how much of the criteria you meet and how many incidents you have within that criteria. If you do want to join the Discord, I can send you some more about that if you want. Just drop a message in the Discord and I'll send it to you.
Indeed. And Hattie, thank you very much. There's the episode there, with a link to the broadcast we did with Veda Ashley on CPTSD. She has it, and it was a great conversation. So give that a like, a follow, a share, if you will. Shameless plugging, and and yes, like Gemma said, please join our Discord. We can get more information distributed that way as well. So let's look at this last slide before we have to close up shop for the evening. Treatments. What do we do with it with dissociative disorder?
Right. So treatment. So a safe environment. Doctors will try to get the person to feel safe and relaxed. This triggers memory recall in some people with dissociative disorders. Psychiatric drugs such as barbiturates or hypnosis may help to recover repressed memories, although this is a form of treatment for dissociative disorders is considered controversial. Psychotherapy, also known as talk therapy or counseling, which is usually needed for the long term. Examples include cognitive therapy and psychoanalysis. Stress management. Stress can trigger symptoms. And then treatment for the other disorders. Typically, a person with dissociative disorder may have other mental health problems, such as depression or anxiety. Treatment may include antidepressants or anti-anxiety medications to try and improve the symptoms of dissociative disorder.
Right. That's something I failed to mention earlier. It was in my notes, and I just didn't. I just scanned over it, I guess. But pretty important to mention. We've gone over co-occurring disorders before, like depression and anxiety. Usually are co-occurring disorders. Well, dissociative disorders are often co-occurring with depression or anxiety, because they are obviously big triggers for it. So treat one of those, you might get a handle on the other, which being the dissociation. As always, there's psychiatric medication available that has to be prescribed by a doctor. Hypnosis, for those of you that are willing to try that. I gave it a try. I think I've talked about it before on the show. I tried hypnosis for just to add on to being sober. I did alcohol hypnosis. Just an extra tool in the toolbox, right? I haven't drank, so I can't say it didn't work, right?
Yeah.
And then obviously talk therapy should be done with whatever level of treatment you're getting. You should have somewhere in there talk therapy with a psychologist or a counselor, a clinician. Stress management is kind of the nuts and bolts, though, because if stress is the biggest trigger for this, or one of the big triggers for it, if we can manage our stress, then it shouldn't trigger it, right?
It's something so obvious, but then so difficult to do as well.
Right. And often we are finding a lot that is just like that. Like kind of a smack in the face. Like, why didn't I think of that? One of my favorites was lateral processing. I learned about that. If you're angry, there's a emotions wheel, right? With
Mhm.
6 major emotions: joy, anger, fear, and if you want to take care of your anger, you have to laterally process to joy, which is right across do something joyful, do something that makes you feel joy or makes you happy inside, and that'll alleviate your anger. It's shit simple and no duh, but do we think about it, or do we practice it? Like, oh
Mhm.
yeah, that's that makes sense. Um, so that's a look at uh, some treatment options. Um, if you obviously, as with any episode that we do, if you're feeling like this sounds up your alley, this sounds like something you might uh, recognize, or um, feel like you might want to learn more about it, or dive in more, maybe get seen for, we always recommend following up with a doctor. Gemma and I are not professionals. We are just two people that struggle with, or struggled and still do struggle with, their mental health, and want to get out here and just chat about it and make it more normal, to try and hear from others how they cope, because that's what it's all about. How do you deal with your shit? So I know how to deal with mine, or maybe that doesn't work for me, but it was still a good chat, right?
Mhm. Yeah.
Um, so yeah, that's what the Discord's all about. So come on in, join the Discord. Let's go ahead and wrap this thing up. Jim in Chicagoland. That's at Jim in Chicagoland on Twitch, twitch.tv/Jim in Chicagoland. Give him a follow. Wednesday nights is Catalyst Night here on Twitch. That's at 11 p.m. Eastern, uh, give or take. It's not a hard 11. It's 10:30 sometimes. It's 11:30 sometimes. But it's 11. So come on in and join the broadcast as he sits fireside or by a candle. It all started with a citronella candle, if I remember correctly. Um, and share some campfire stories. Come in, chat. Very low key. Very good for the mental health. Very good unwind or midweek unwind stream. Also, whoopsies. Let me not skip over our good buddy Ray. Ray, I missed your stream last night. I saw you were going live, but I was at work yesterday. Um, but I always try and catch any kind of replays that I can, because I'm not so much into regular television anymore. It's just there's nothing on
It's
ever. So I,
depressing.
I usually find myself watching Twitch replays or
Yeah.
VOD. So Ray of Sunshine on Twitch. He's in chat. Click on him. Give him a follow, please. Gemma, my co-host, has her own channel, twitch.tv/GemmyH83. What are you doing over there these days, Gemma?
We're going to be doing some more cooking soon. I've been saying it for the last few days, but it's going to happen. But then there is going to be a cooking train. I think it's the last or the second last Saturday of the month. I can't remember the date.
Right.
But yeah, crafts, cooking, just general fooling around, anything.
Right on. And she also has other socials as well. I just realized your bio link's not on there. I'll add that into the command so that
Mhm.
it shows up as well, because she has a YouTube channel. And then of course all the socials, Instagram and such. So you can
Everything.
give Gemma a
Everyone.
follow. Um, and then Eric, who has joined us this evening. Let's not forget our good buddy Eric, who was on the show. He is live every Monday night at 7 p.m. Eastern Time for some video game play and chat. So give him a follow. He's a good dude. Um, and he's also over on the Discord as well. And then finally, as always, don't forget about our bunny friend, Ella the bunny mom. I saw her on this morning at a ridiculous hour when I got home from work, and I almost popped on, but I was just exhausted, so I went, tried to catch an hour or two of sleep. Um, Join her late nights here on Twitch as well, at Twitch TV / Ella the Bunny Mom. late night, and I mean late night streams for the ukulele and singing, and of course her famous sidekick, Puppy Cat, the bunny. Ella is all about bunny rescue, and you can visit her website, mybunnyvalentine.com, with an online store for her merchandise. I have a bunch of it around here. Penelope has seemingly taken everything. I don't have anything on my desk to show.
Kids. Yep.
Loves all those bunny rabbits.
It starts with the bunnies, then it gets to the money. Trust me.
Yeah. And there's also stickers, there's apparel, all kinds of good stuff on there. Electronics. Use the Fire Dude 15 promo code as it's written there in the command. Save 15% off of your purchase. And that's to help support Ella, our good friend, and a former guest on the show. Of course, our links are tmhhonline.com and bio.link/TMHH for everything Mental Health Hour. If you like the show, if you like the content, if you like what you're hearing on the podcast, on Spotify, or wherever you're listening, wherever you're watching the replay, please consider sharing us out to anybody you might think benefit from us or from our show, our podcast here. Help us grow. Give us a like, give us a follow, give us a share. That's all we can ask.
Yep.
That's the biggest thing that you guys do for us that are here week in and week out is share us out, like our stuff, subscribe. And it doesn't have to be monetarily. If you do monetarily donate, it all comes back to the show in the end. We put it back into this lovely broadcast like StreamYard and Canva, which we use quite a bit for like the intro videos and all the promotional stuff. But we don't ask for any money. We just like talking, we like chatting, we like hanging out every Wednesday night. So just subscribe to our channels, as in like it, and share it out, please. That's all we can ask again. Next week, I forget what we are discussing. It is on, I can pull it
I
up.
will tell you in a quick second because I had it a minute ago. Well, if I press the right buttons, I did. Seriously. We have it here. So next week, impulse control.
Impulse control, that's right. This is going to be a good one. I'm looking forward to it. It's something that yours truly struggles with.
Amazon. Midnight.
Huge part of me being an addict, or alcoholic addict, impulse control. So that's next week. We'll see everybody back here next Wednesday, same time, same place, 6 p.m. Eastern, 11 p.m. Gemma time. And
real quick, there's that form online if you are interested in calling into the broadcast. That is now on the bio link. Fill in the form, state which episode you're interested in, rough idea about what you want to talk about, and we will get in touch.
Yes. That's something new that we're going to be bringing to the show. Every once in a while, we'll do a show where we have call-ins. You can call in and just talk about what the topic is at hand, and we can interact with you more that way. If you want to, of course, you can just hang out and chat as well. But that all involves catching us live every Wednesday at 6 p.m. just for the recording of the podcast. And of course, then I go back and edit it down. That's all we got. We'll see everybody back here next week. Thanks for joining us tonight. And thanks to all the subs, bits, and shares. We appreciate it very much. Bye now.
Bye.